Coming up on Network Africa. Botswana's president Masisi is cleared of COVID-19. Lightning kills 20 people during coronavirus lockdown in Congo, Brazzaville. Plus, Kenya to receive $50 million from the World Bank to fund efforts to curb the spread of coronavirus. Hello and welcome to the program. I'm Layo Adegoke. Welcome again to the program. Less than 2 months after Egypt became the first country in Africa to confirm a coronavirus case, the outbreak appears to have reached almost every nation on the continent with 1.2 billion people. Of Africa's 54 countries, only 5 are yet to report any case of the COVID-19. This includes Comoros, Lesotho, Sao Tome and Principe, Malawi and South Sudan. The virus has affected several top officials around the world, but the latest official to receive a clean bill is the president of Botswana, who has tested negative for the COVID-19 after being in self-isolation for 14 days. He had gone into quarantine on March 22nd after returning from Namibia. At the time, the neighboring country had had 3 confirmed coronavirus cases, while Botswana had none. Botswana has to date confirmed 4 cases of COVID-19, including 1 death. The country has also gone into lockdown from Thursday for 28 days, after President Masisi declared a state of emergency earlier in the week. Now, African governments are continuing to roll out stringent measures to prevent the spread of coronavirus, which has taken the lives of more than 200 people across the continent. Togo's President Faure Gnassingbe has declared a 3-month state of emergency to this effect. He said the seriousness of the situation warranted the measures, which include the immediate start of a curfew from 7 p.m. to 6 a.m. A 5,000-strong unit of security agents is also being set up to tackle the pandemic, as well as a $650 million fund to help cushion the economy. According to reports, during the state of emergency, water and electricity is to be supplied free of charge. The West African nation has so far recorded 36 confirmed coronavirus infections and 2 deaths from the disease. Well, over in East Africa, Eritrea has begun a nationwide lockdown for 21 days. The announcement came after the health ministry reported 3 new cases of the virus, putting the total number of infected individuals at 18. One of them is a 13-year-old girl who contracted the disease from her mother, who had been abroad. During this lockdown, all citizens, including public sector employees, are to stay at home. 1 member of each household is also allowed to go out to buy essential food items during the day from grocery stores, which can also remain open. The government in Rwanda has extended its rigid lockdown restrictions imposed last month by 2 weeks to April the 19th. The lockdown that began on March 21st banned people from leaving their homes unless going out to shop for food or to buy medicine. Police authorities have been deployed to enforce the restrictions. The lockdown was to end this week, but was extended by the cabinet on Wednesday after the number of confirmed cases climbed from 17 to 82 in 2 weeks. And unfortunately, some 20 people have been killed by a lightning strike on high-voltage power lines in Congo, Brazzaville. Now, according to authorities, the incident happened on the first day of a lockdown in the capital, Brazzaville, to help prevent the spread of the coronavirus. So far, 22 cases of COVID-19 have been confirmed in the country, including 2 deaths. The mayor of Kintele district, Sela Ngweso, said people were electrocuted by the falling cables. Well, back here in Nigeria, more states in the country are recording new cases of the novel coronavirus, and precautionary measures have been put in place to curb its spread. Ogun State, which shares boundaries with Lagos, that has currently the highest confirmed cases of COVID-19 in the country, is marked for a 14-day lockdown beginning tomorrow, Friday, April the 3rd. The state currently has only 3 confirmed cases of COVID-19, but it understands that there are other potential threats coming from other neighbors, Oyo and Osun states. While residents prepare to stay at home, they look forward to the government's relief package, which targets the poorest in the state. Our correspondent, Ini John Mekwa, gives us more.
Residents of Abeokuta, the capital of Ogun State, are busy with preparations for the lockdown, which is to begin on Friday night. For the market women, they're not looking forward to the coming days without the intervention of the government. For the buyers, stocking up for the period has become difficult.
Gari has turned to 300 naira from 120. The last time I bought it was 120. It's now 300 naira.
But the traders say the hike in price is for a good reason.
The cheapest transportation in Nigeria is Abeokuta. There's one we enter 30 naira, 20 naira sometimes. But now, because they are going to take 2, 3, then the money will be increased. Like this egg now, we sell it 800 before. Then before they can take all us like a crate, they will tell us we should pay 2,000. Where are we going to get the money? We have to put it on the egg. That's why now egg is 1,000.
Special advisor to the governor on communication, Remy Hassan, assures the people that to some extent, food, which is the most basic need, has been planned for.
We are setting up food banks in the 3 senatorial districts and working out a distribution template that will reach out to this poor of the poor, using stakeholders like the various community development associations, neighborhood leaders, traditional leaders, and other stakeholders, so that only those who need this palliative get it.
Already, the state has closed its local and international borders, preparatory to the restriction of movements within the state from Friday, the 3rd of April. Ini John Mekwa reporting for Channels Television News.
And as the coronavirus pandemic sweeps across the world, pregnant women face giving birth with a mixture of anxiety and concerns about how the virus could affect them. Healthcare authorities have introduced varying rules in different countries, deciding whether a woman can be accompanied during childbirth, for example, or if she must be separated from her baby if she is sick. The novel coronavirus is a new strain not previously identified in humans. There have so far been over 930,000 infections and at least 47 deaths globally. Well, there is a lot we don't know at this point, but joining us to shed more light on this is Dr. Abosede Lewu. She is the founder of Girls Aid Initiative. Thank you so much for speaking to us on Network Africa. Firstly, doctor, let me ask you, this is a new virus, but I think one of the main questions that soon-to-be mothers have are they are more at risk than others. You know, they think about that. Can this virus be transmitted to their baby?
Hello, and thank you for having me on with you today. Like you said, COVID-19 is a new disease. Don't know much about it. Most women that are pregnant are more at risk than women that are not pregnant. So, I have associated pregnancy with new information keeps coming. Of the viral infection, we were hot when we
Dr. Leo, seems like we're having some audio issues, but we'll try and reconnect. In the meantime, Kenya is to receive $50 million from the World Bank to fund efforts intended to prevent the spread of coronavirus. The Health Minister, Mutahi Kagwe, says the amount will be used to procure protective gear for health workers, hand sanitizers, as well as to increase the bed capacity in hospitals. Health workers have complained of a lack of adequate protective gear in their facilities. The Health Ministry has confirmed that one health worker has tested positive, with the local media reporting it had happened after the person came in contact with an infected patient. And as South Africa continues life under lockdown, Lucy Malimele, she's a senior citizen who says she's forced to break the law for the survival of her business. The 69-year-old woman who runs a fresh produce informal business is out on the street to try to save her dying business during this coronavirus outbreak.
Great-grandmother Lucy Malimele says she has to break the law to survive. She sold fruits and vegetables from her stall since 1983, one of millions who work in South Africa's informal sector. But amid a 21-day lockdown, the army and police have been coming to close down stores at Soweto's Kliptown market. As the sole earner in a family of 8 grandchildren and great-grandchildren, the 69-year-old says she had no choice but to keep breaking curfew, even though a pool of customers had dried up.
There is no business, meaning the business is dead, unless I break the law like I currently am doing. I got some produce which is not allowed, but I still went to get it. Being here is not even allowed.
In an economy already suffering recession, power shortages and high unemployment, South Africa has not promised massive fiscal stimulus to cushion the blow like some other nations. It has brought in some measures for small businesses, but not offered any support to the informal sector, which statistics South Africa says accounts for 6 to 7% of GDP. The World Bank says out of all South Africans currently working, 25 to 30% operate in the informal economy. President Cyril Ramaphosa has said the government is urgently developing additional measures to provide relief for informal businesses, but he has not specified when measures will be announced. For workers like Malimele, that means waiting for the lockdown to end and hoping for a return to business as usual.
A Somali doctor who escaped an execution, battled the deadly diseases in his country and treated war victims, now at 35 years old, he's been tapped to lead the nation's response to the coronavirus outbreak. So far, Somalia has only 3 known cases, but there are fears that if the disease is unleashed, it could race like wildfire through camps of malnourished families huddled on the makeshift domes built from sticks and rags.
Dr. Abdurazak Yusuf Ahmed, tall and bespectacled, has had run-ins with the insurgency before. Out of a population of 15 million, conflicts or disasters have forced 2.4 million people in Somalia to flee their homes. He fears for all the vulnerable. Right now, Somalia only has about 25 intensive care beds, 110 quarantine beds, and 100 treatment beds available. In the capital, patients at the old Italian-built maternity Martini Hospital have been moved out to make way for a coronavirus ward.
We are still preparing. We have a few medics that are now trained to work in the ICU. We have very few health facilities. 80% of the coronavirus patients usually arrive, but the elderly and the weak need modern intensive care, and we have no ICU that will meet their specific needs.
The Health Ministry and Prime Minister's Office have allocated about $11 million for coronavirus preparations. Expenses are high, all medical equipment is imported, and coronavirus tests are sent to Kenya for processing. The UN is flying the tests abroad, 49 so far, and the World Health Organization has trained 500 health workers since January. The World Health Organization has trained 500 health workers since January, and has brought in personal protective equipment sufficient for the first 300 or 400 cases.
We have trained more doctors and nurses, but that is not enough. The plan is for a comprehensive plan that is preventive, and that includes self-isolation, quarantine, monitoring, psychological support.
His biggest worry is that the disease could spread quickly. Somalia has a tradition of physical greetings, and even wealthy people are reluctant to isolate away from their family.
You're watching Network Africa on Channels Television. Still ahead on the program. The world celebrates World Autism Awareness Day. It's a day set aside to recognize